topic you want? Describe areas. Please let them know. We are addressing knowledge. Describe the areas. Yes, does not matter. Same topic. First one long question, two short answers, and 3 answers. So that we can finish our we can decide the marks. You can decide the marks. 10 marks you can divide any lesson. There are different marks. Yeah, 10 marks. Only 15. Only 5. Actually, it's not short answer. See, I told you 2 types of short answers. One is question. Another one is what is that? List with blanks. Types. So that we can discuss. Yes, you can. We will discuss. This is not for the purpose of for discussions. How each person does it so that we will understand. Don't worry about the answers. Don't worry about the answers. But that also we will discuss some answers, easy answers. They are trying to see how the student can answer it. Discuss how to answer. So that's what. When you press it, everyone will comment. So it is just commenting for understanding. On each page. Because of Relationship analysis type ಒಂದು ಸಿಂಪಲ್ ಅನಾಲಿಸಿಸ್, ಒಂದು ಸಿಂಪಲ್ ಮತ್ತೆ ಇನ್ನೊಂದು ಯಾವ ಮಾಡ್ತೀನಿ ಅದೇ ಫಾಲೋ ಮಾಡಿದ್ರೆ ಒಳ್ಳೆಯದು. What is more important is the instruction. That is important. Question is not important. How you are going to frame the. We will discuss. We will discuss. As much as possible, avoid the word to discuss. Please write your group name on each page. Last minute. Write your group name. Super 6. This is from team Narendra Modi to you. You can name your team. Amit Shah.
पूरा ಒಂದೇ ಕ್ವೆಶ್ಚನ್ ಅಲ್ಲಿ ಟಾರ್ಗೆಟ್ ಅಂತ ಡೆಲಿಗೇಟ್ ಬೇತೆ ನಿಂತಾರೆ ಆ್ಯಕ್ಚುಲಿ ಪೂರ ಕವರ್ ಆಗ್ತದೆ
various types of MTP.
Regarding what I think is one of the biggest suspects in the entire thing. What is his name?
Okay. You have got 2 minutes to analyze, and then you have to come forward.
timing
Okay, can we have the group leaders to come forward, please? Group. Micro.
Start with Group E. Arvind. Start from Ulta.
Okay, start from here. We'll start from here. They're shouting at us. I can't. Okay, please and slowly. Start. Okay, please. Kindly listen.
Mic a little closer.
Yeah. Good afternoon. This is the afternoon session. I hope everyone is awake. So our evaluation of Narendra Modi team.
Raise your hands, please. Narendra Modi team. Oh, very good.
Okay. Well done. There are few questions which was not framed properly. First question, that is an essay question. Read the question. Okay. 32-year-old lady G2P1L1 with a 8-week conceived with the failure of barrier method of contraception of gestation. How many weeks? 8 weeks of gestation. Doesn't want to continue pregnancy. One, explain about methods of MTP. Second question, explain steps of surgical methods of MTP. Third question, recognize the complication involved with the surgical methods of MTP and treatment. Here the first question, which asked a methodology of MTP. Actually second question is surgical method of MTP. Almost like a first question, the answer is there in the second question. So
No, it's a different. You have
There are many
see,
methods
one
of
of
MTP.
the-
I know, one of the method, like I'm saying, one of the method is given now.
But the student can guess it.
Yes. So, no, it's not like MCQ question. Yeah, understood, ma'am. It's not an MCQ question. But here the point is that you are asking the first question where patient, even though student is not studying, they know there is something called surgical and there is something called non-surgical. So that part of the answer is like to them.
Okay. The first thing I would like to say here, MTP, maybe you will have to really be careful if you are using the short terms first. This I am talking about framing the question. I am not worried more about the answers here. Framing the question first, MTP, maybe you will have to write medical termination of pregnancy.
The act itself says MTP Act.
Okay, you write medical termination of pregnancy act, then you write MTP act, then you keep using MTP act. No problem. In framing, I am talking
One of the
about
accepted paper method is no short form.
no short forms. Avoid short forms.
Now third question you have asked, recognize the complications involved with MTP and treatment. But you have given complete 4 marks for that. But there is no proper division like how much is going to be for mentioning the surgical method and how much is going to be for the treatment. So the student can have a confusion whether to give 1 mark for this and 3 marks for that or 2 to 2.
Better word, recognize the complications. What would have been a better
Enlist. Recognition is only for the person who has been doing it. See, students cannot recognize the complication. That is the reason.
You're given it as recognizement. So sir is saying
don't
enlist.
use that word recognize. I'm telling you, use a better word. Enlist whatever. You can use better terminology. Enumerate, okay, no problem. Enlist. Whatever, you will have to be careful while using the verbs. So marks have been given for that?
Divided the marks. How much is each?
No, they have divided 3 plus 4 is equal to 10. Like that. You will have to mention it properly. 3 plus 4 is equal to 10. And then you have written 3 marks. She got confused. That's all.
That's all.
In the third question, there are two questions.
There is a 2 question in 1 question.
You will get chocolate.
Yes.
Okay, second question.
ಬೌಲಲ್ಲಿ
Bowl ಅಲ್ಲೇ ಉಂಟು.
Short notes, mention any 3 ophthalmic side effects of pilocarpine. Name any 3 branches of femoral artery in the femoral triangle. And write the boundaries of Hasselbalch's triangle.
Write the what would have been better? Third question, write the boundaries. What would have been a better verb? Mention would have been, write is not a, I don't think so it is a good verb to be used in the question. Okay? Any other? First one is mention any 3 ophthalmic side effects of pilocarpine. Okay, fine. Name any 3 branches of femoral artery in the femoral triangle. Who is anatomist here? You have done this, no? Okay, so no other anatomist to comment on this. Write the boundaries. Off is not there.
Off is not.
Okay, Hasselbalch, that's fine. That you will be called to the examination hall to correct it. Okay. Boundaries of Hasselbalch triangle. Fine.
Mention.
So yes. Fine. Fantastic. Okay. Only that. MCQ. Last one. MCQ.
MCQs. There is one indications for MTP. Except rape, congenital anomaly, failure of contraception, and more than 28 weeks of pregnancy. Here, one is that full form of MTP, another one is full entire sentence is not.
Very, I'm sorry, I have to tell how it is. Not very well formulated MCQ. Indications for MTP except. All of the following are indications of MTP except.
Full sentence.
Complete sentence you will have to write. Question. We'll talk about the formulation.
Next. Second question, they have asked match the following. That 4 options are given.
First line,
Second line is surgical methods, police method, illegal abortion, R486 loaded. But they have not given the options where match A, B, C, D. They have not given.
See, my comment on this, sir. You have not written the question. Match the following. First thing. And you can write, you can give us tiny introduction to the match the following. Match the following to the, match the answers to the, what is that, first trimester or what you call that connection. So that would have been better. Okay. Options are not given, that is fine. Okay, next one.
They have given as a true and false. There are also no MCQ, but true or false. Where primary with 24 weeks of gestation with the anencephaly, she can avail termination. Yes, true or false. But there are again no options, but it is like a selection.
Primary with 24 weeks gestation with anencephaly, she can avail termination. See, this becomes more of a consultant discussion rather than a question. Let it be, yeah, ask it as a question. 24 weeks, a 24-week old primary with anencephaly. I think it has to be framed properly. The sentence should be framed properly. How can you frame this sentence properly? That's all. I am not only telling framing of the sentence.
The sentence is proper, but for true or false, you need not put it as a question because it is a statement which you are accepting or denying.
It becomes more of a consultative discussion here.
they are thinking whether audience makes as a 24 weeks. Can you go and put the extra one?
That would be a better. This is a better way of asking. Okay, thank you very much. Please give a big round of applause to the team. There was a lot to discuss. Thank you. Take your chocolate. Yes, next group.
We got the question paper sent by the group Magicals.
We got the question paper sent by the group Magicals. The essay is a 35-year-old female patient named Jayanti came with the complaints of low-grade evening rise of temperature, cough with expectorations, since the past 1 month. On sputum examinations, AFP staining is written in bracket, and on chest X-ray, she was diagnosed to be a case of pulmonary tuberculosis and was put on first-line anti-tubercular drugs. Then in bracket it's written 2 plus 6 plus 2, but it's not written marks. Then after that it's written list 4 first-line anti-tubercular drugs. So the marks should come in line with each of those questions ideally. So the top is written 2 plus 6 plus 2, that's okay. Now list 4 first-line anti-tubercular drugs is first question. Second question is mention 6 uses and 6 specific adverse effects of rifampicin. And third question starts with discuss. Discuss the recent pharmacotherapy for MDR-TB. So discuss is not an appropriate word.
Okay, let us just. Okay, yeah, 10 minutes. No, not like that. He also discussed with me regarding discuss. Because he does not know how to frame that question in a better way. Discuss the recent pharmacotherapy of MDR-TB. If you can just explain the answer, we can just give you an idea.
So for MDR-TB, we have intensive phase and continuation phase. In intensive phase, we use 6 drugs, and continuation phase, we use 4 drugs for a certain period.
Question, tough question. How higher order question?
No, then
Phase. When you know it is a university format question, therefore we go with that frame. If it is a tough question, always think twice before framing that question.
Direct question.
Categorization.
Continuation phase, these drugs की एक
Sir, what is the marks allotted for that particular answer?
Two. Intensive phase 1 mark, continuation phase 1 mark.
Then you can ask specifically what are the phase-wise recent guidelines. So they have to mention the phase, intensive, all those things. Like instead of discuss,
guidelines would have been a better terminology. Mention the guidelines for mention the recent guidelines for
phase-wise, because you are asking for only 1 mark each. When you tell discuss, they'll just go on writing.
That has to be specific.
Specific.
If it is a 1 mark question, it has to be specific. You can't discuss.
Discuss.
And we can't.
We cannot.
2 marks discuss is a little bit overstretching. Okay, what are your other comments? 35-year-old female patient Jayanti came with complaints of low grade evening rise of temperature. Okay, that is fine. Past 1 month. On sputum examination, AFP staining. Okay, you mentioned it like that. And on chest X-ray, she was diagnosed to be case of pulmonary tuberculosis. She was put on first line of anti-tubercular drugs. No, I can't get anything in pharmacology. Thank you.
Whether that Jayanti can be used there.
We were not okay. No, 35-year-old female patient.
Yeah, ethically speaking, you cannot use. Because there might be a student with the name Jayanti. That particular student
is correcting.
So they will get offended.
Okay, the next question was list 4 causes of macrocytic anemia.
Okay, short questions. List 4 causes of microcytic macrocytic anemia. Okay.
And explain the peripheral smear and bone marrow findings of megaloblastic anemia with diagram.
How many marks?
2 plus 3. 2 plus 3.
So I want your understanding now here. We have asked
Short
too many
answers.
things.
Yes. And there is no, and it's all one line. There's no
Short answer
question.
gave the short answer gave the 3 marks.
And the marks distributed is only 2 plus 3. Why you ask 3 things? So the distribution has to be more accurate. Yeah, actually you are told 3 marks question, but it is become 5.
5 marks, okay. So that's fine, that's
That's
okay.
okay. That's one thing, the distribution is ambiguous here also. Then enumerate the signs and symptoms of acute gouty arthritis, full stop. Mention the specific diagnostic test of the above condition. Again, the mark distribution is written 2 plus 2 plus 1. So we have to assume that 2 plus 2 is for signs and symptoms. and one is for specific lab diagnostic test of the above condition. So the mark distribution is little ambiguous.
No.
Then coming to the MCQs.
You want to counter, man. You want to counter.
Very tight.
Very tight.
Signs and symptoms usually one question.
One, it's
There
one
is
question.
no sign, there is no symptom. You cannot give
To
two.
the teacher, she might be
Undergraduates, that's
Too much it becomes.
No, these are four, I don't know, I have to search for the
No,
fourth.
I'll also have to say.
While graduating.
No, it is fine. So we need to be careful regarding framing of maybe too many questions, too many causes also will be a little tight on the student. Okay, fine.
Now MCQs. Amino glycoside used as an antitubercular drug is A. Tobramycin, B. Neomycin, C. Streptomycin, and D. Natromycin. This is a straightforward question. That's okay. Then sunflower cataract is seen in cirrhosis bulbi, Wilson's disease, Mayan syndrome, and galactosemia. Now both are actually the similar type of questions, straight answer questions, a direct answer. Then third one, mention the following conditions with enzyme defects. So actually it is actually match the following. So they have given options on two sides, phenylketonuria, phenylalanine hydroxylase. The options are left out. A, B, C, D, what to choose is not written.
On both the sides you have written 1, 2, 3, 1, 2, 3.
1, 2, 3, 1, 2, 3.
No, it's written 1, 2, 3, 1, 2, 3.
1, 2, 3, 1, 2, 3, and also below how do you write A, B, this thing? How do you choose? It should be A to 1, or B to C, it should be options. Then you write A, B, C, D.
No, that is only instructions. We are only bothered about the instructions here. Answer Allah. Clarity regarding the, you should mention the following clinical conditions with the enzyme defect.
Match the following.
Match the clinical conditions with the clinical defect. Whatever.
Match word does not come in the question at all. So we have written match, very match.
With the enzyme defect. Aminoglycoside used as an antitubercular drug is, it could have been framed a little better, the aminoglycoside drug used in treatment is. Better, I think so. No, that is English, agreed, but still framing of the questions will be important. Okay. Thank you very much. We have finished group 2. Chocolate, allowed.
We have got the paper set by the team Abhimanyu.
Who is Abhimanyu? Okay.
The long essay was a 60-year-old male came with painful diminution of vision following trauma with a wooden stick. On examination, corneal lesion with feathery margin was noted. What is the probable DX? I think it should have been diagnosed.
This is not short term, this is medical terminology. DX diagnosis. You will have to, what is the probable diagnosis?
What is the probable?
What is your provisional diagnosis? Better, I think. Okay, next.
That was 1 mark. Enlist the clinical features of this condition for 4 marks. It's fine. Plan the investigation and MX for this treatment.
You also don't know what is MX. Short form, you will have to be careful, I think so. In that,
Plan the investigation.
Plan the
investigation.
Enlist the lab diagnosis. Enlist the lab diagnosis and lab and management of the group condition. Something like that. That would have been better. You can do 2 plus 2, something like that. How much?
They have given 2 plus 3 is
Okay, fine. That is okay. Yeah. So usually long answers and short answers will take a little. It is easier to frame whatever it is. It is easier to frame. Today you have done mistakes, but I think so while writing to your question paper, you will improve upon that easily. MCQs will be a little difficult.
But usually management includes both investigations and treatment.
Okay.
If you say we usually teach them like that.
Better to segregate.
Better to segregate.
Better to avoid that management.
Avoid management. So, treatment and okay, next.
Short answers. First short answer is enumerate 3 complications of gestational diabetes mellitus. Then 3 marks.
3 months. Okay.
Second one was compare cephalhematoma and caput succedoneum. Give 3 points each. Give 3 points each.
Compare, I don't understand the question. Compare cephalhematoma and caput succedoneum, give 3 points each.
Differentiate it.
Mention 3 differences between.
Simple language is always simply easier to understand. That is, how did you do it? Enumerate 3 differences between cephalhematoma and caput succedoneum.
MCQs. Clisson fishing in cornea is found in Wilson's keratoconus pterygium siderosus.
Caser flesher ring in cornea is found in. Okay, caser flesher ring, fine. It's written. You have written full form, but you have written Wilson's. Sorry, Wilson's disease. Wilson's cirrhosis or whatever. Wilson's disease. Wilson's keratoconus pterygium caser flesher ring in cornea is found. Your distractors are not very distracting. Wilson's disease, agreed, it's the answer. Keratoconus, madam, is it a better, what would you say? I think it is better, no?
You also get one more leisure in
Ah.
so it's a distract.
It's a, okay. Then pterygium, is it a good
You
distract?
get one more stop the story.
Okay, all this. No, means I would have, as outside ophthalmology, I would have told better to give, Wilson's disease you have told, okay, then you tell tuberculosis. You tell, give the disease names. Something, I'm not
We
asking.
are thinking in terms of inks and the pigments in the eye.
Okay.
They are looking at the eye only. That way it is
Yeah.
correct. It's correct.
Other conditions.
Okay. So in this only Wilson's. Only Wilson's is the mistake. Okay, fine. Next one.
Match the following. Carcinoma cervix, chlamydia tract. Match the correct answers. Remifentanil, local anesthetic, cocaine, antiarrhythmic.
No comments on handwriting, please.
Amiodarone, opioid.
दिखने का तब है फार्म होता है दिखने का स्टेशनरी करता है
One minute. Just how could you improve the question? Match the
quality of paper has to improve.
match the drug with the. How would you?
Classify, maybe classify the correct drug with the.
No, it's
Match the drug with the clinical features.
One is a classification, one is a drug. Group of
Match the following. What I
That's the
see.
following, sir. You don't have to give the heading for it.
That's the correct answer.
You feel?
It's like
Like this only. Okay.
So in one group
that
it
is why we need to
is
No, they have to be mentioned.
That's why I think
Concept has to be mentioned. Concept have to be mentioned.
with the appropriate class maybe you can say.
ಇನ್ನೊಂದು ಬರುತ್ತೆ.
Sir, ಅಲ್ಲಿ
Okay, thank you. We need to go ahead. Next one, please. Thank you very much. Thank you. Next one, please. Next one.
I think we've got from the Super 6.
Yeah, the Super 6.
Okay, a 25-year-old pregnant lady visits OBG, OPD,
Her serology report showed positive for HIV. All short forms. You guys pointed out
It is accepted as HIV again, you know.
Three short forms in one question.
one line.
OPD
Then define AIDS again.
We write acquired immunity.
No, that's okay, that's fine. But, and then define AIDS, what do you want the answer? What is the answer?
Ask them to check the spelling.
Yeah, so you for that
Go for the certificate.
mark. Okay, that's why.
But it's the answer to the question.
MTP it's in the parliamentary bill and MTP is well accepted short form.
Yeah, MTP is there.
Standard parliamentary bill.
Okay, so I'm not talking about that. I'm just telling.
MTP is standard. It's standard.
Okay, define AIDS, first one. Second question, what are the different modes of transmission of HIV? So you are given 3 marks question as A and B. Okay, so it would have been, you made it into a clinical question and made it A and B. ABC. How many marks this is?
10 marks. The third question is divided into.
Okay. How will you prevent mother to child transmission during antenatal?
That we need to
disease?
rephrase the question. How will you prevent mother to child transmission? What are the methods to prevent would be better? As rephrasing what are the methods to prevent mother to child?
What have they written?
Explain the methods of prevention.
Ma'am, could you please repeat the question?
The question they have framed the C part of it is how will you prevent mother to child transmission during antenatal, labor and postnatal?
And the marks allotted?
There you go.
2 plus 3 plus 2. In the third part. As in C. So I just wanted a rephrasing.
Rephrasing, how to rephrase
What are the
this?
methods to prevent?
Could have 2 plus 3
Last part of the question, like Nana distribution.
Maybe use a better verb there and finish it off in simple language. You have told antenatal, the other 2 you have told. Instead of that, directly what she is telling is mother to child prevention. Okay, fine. You are given 5 questions.
In various stages of labor, no? I mean, various stages of pregnancy.
See, there are so many things that you need to be careful regarding this one. But I don't think so we are framing like this. Are we really framing like this? Questions? This is, here we are studying, but we are not framing it like this. If you frame it, I think so, students will really study according to this.
Total 7, which is again divided to.
We have started
According
framing
to your
syllabus.
question paper, you have to frame it like that.
Yes. Now it is, shift is there. It is changing, but I am seeing some question papers are framed better, some questions are not framed better. It shows this question paper was done by some 60-year-old professor. This was done by a 45-year-old professor. It looks like that. The younger professors have started framing it according to CBME.
No, we DMP question paper was like that earlier. Then it was changed to one-liners. Now again,
It's coming back.
So we have
Gone through this.
bigger. In fact, I prefer that rather than one-liner question.
It's better, you know what objectivity. The only thing is objectivity. You know what to mark for what. Okay, next one please. Thank you very much. Finish one.
Short essays enumerate 3 induction agents for anesthesia and 1 contraindications you have written, which is for each agent. And classify anemia according to ICMR guidelines, and you have put a question book. Just typed up in the end. No, it's still there. It's still there. We have underlined. And marker for infectivity, that's a straight policy. And this I thought was very confusing because the marker match the following disease and sample for isolation. One side is that one with one that dot.
1, 2, 3, 4.
Kind of, it's something you get
Oh,
very
see what
confused
mistake
with
you have
it.
done here. You have combined match the following with the assertion type. You have come
Yeah,
both.
that,
You have told match the following. Your answer should be direct. A1, B2, C3. That is match the following. Otherwise, you should have given one more instruction. Which among the 4 is the correct?
yeah, it's either match the following or this is like an MCQ of a match the following, so it's very
It's very confusing for the student.
And I think the last one is
Done, right?
again an MCQ which is all.
I never knew that so many mistakes will come. Yes.
We've got the jam-packed question paper. The long essay, 60-year-old male presented with swelling in the neck and axilla for 2 months. On examination, he was found to have generalized lymphadenopathy and splenomegaly was present. Serology was negative, chest X-ray was normal. What is the possible diagnosis? That is 1 mark. Define and classify your diagnosis, 1 plus 2. Describe the pathogenesis of one of the types. That is 4 marks. And enlist the investigations to come to the diagnosis, that is 2 marks. So,
Which subject is belong to?
I think by the time we reach the third question, we are a little confused. Describe the pathogenesis of one of the types.
That's right. At least one hint they could have given as to in which direction
it
you
is
want
going,
us
yeah,
to go, right? Very good.
60-year-old male presented with swelling in the neck and axilla for 2 months. On examination, he was found to have generalized lymphadenopathy, splenomegaly was present, and serology was negative. So your diagnosis, it becomes a little difficult for the student, I think so. Okay. I mean, but UG, in UG you need to be a little clearer like this. UG will have to be clearer. What is the possible diagnosis? Agreed, okay. Define and classify your diagnosis. Define lymphoma and classify your diagnosis. The answer is lymphoma. So define and classify your diagnosis. Okay, so you need to be
Splenomegaly.
It's the leukemia.
okay. I hope you understood. No, the point, the take-home point is maybe you will have to be a little more clearer in the this one.
In the third question you could have given.
Which one?
If they are thinking in terms of lymphoma only, then they could give a small little hint in the question.
No, hint is very important. For UG though, it is very important. What could be the hint for lymphoma? Peripheral smear findings did not show leukemia. Something like that will have to. Okay. I hope you understood that point. Okay. Yes. Next question, please.
Next question, short answers. Enumerate 6 factors affecting wound healing. That's fine. Enlist 3 differentiating features of Hodgkin's and non-Hodgkin's lymphoma.
This enlist, if you just write the heading is enough. When they
I don't understand the question.
when they say endless, if the differentiating is writing in the heading is enough, they'll give 3 marks, right?
Enlist 3 differentiating features.
No, for wound healing, factors.
Enumerate 6 factors.
So just write the heading.
See,
you just listen.
what happens
Then
is,
the kids are very happy to, because they read the headings of every chapter and so on.
no, but it is like that, no?
It is like that.
No, but I'm saying, 2 long essays, and the rest of it is like that. You
Like
write
that
the
only.
heading, it's more than enough for you to pass.
Question should be little higher order. Probably think of a little higher order. Now when you are saying list, Don't do simple questions. Little higher order. Think about a little higher order.
MCQ.
Yeah.
Appendectomy wound is considered to be a clean wound, clean contaminated wound or dirty wound. A crush injury can cause myoglobinuria. Myoglobinuria can result in AKI. That may be you have to expand all that stuff. Both A and B are true, both A and B are false. A is true, B is false. That is. The third one, there is no question. There is only but A on the ABCD on the side.
Match the following.
Yes, exactly.
That's shortage of time. Shortage of time.
No, even the second question. Second question, crush injury can cause, maybe your instruction should have been more clearer. You should tell relationship analysis question.
No, because those guidelines were given to us. First is accordingly we are changing because the question was told to us was like that.
So you mentioned it here. Maybe in the question paper, you will have to be more clear. Yes. I hope we have come to the end of everything here. Thank you very much, but I have 10 minutes. Sorry, please listen to me for 10 minutes.
We'll be circulating this attendance list now. Please, when you sign, please check your name. Okay, it will go on to your certificate. If there is any correction, please write it down. Correct it.
Okay, so I will just going into a small topic regarding concept of quality assurance in medical education. Now, everywhere they are going to ask us about quality. I know the answer will come down to what we discuss always. Now, the answer will come down to salary in the end. So we will not go that much deep. Okay. So how do we define quality? How do we define quality? I mean, define in the sense, for you, what is quality more? When you say quality, what is important for you? Is it money? Value for money? No, okay, it's not value for money. But if you ask the parents of students, it will be value for money. Yes? Or is it for a teacher, 100% it is an Indian medical graduate here at this point? Yes? Or it, for the research side, that would be more important as a quality aspect. So this is your definition of quality assurance, but who has given you this definition? UK. Totality of systems and resources and information devoted to maintaining and improving the quality and standards of teaching, scholarship and research, and of students' learning experience. We have added everything here. Value for money, research and teaching learning methods. Everything we have added here. So a quality assurance system, these are the attributes. It should have a creditable quality assurance process. It should include all the major stakeholders. Can you tell me who are the major stakeholders in medical education here? Keep the teachers outside. Teachers are always outside. Okay, we are the stakeholders, yes, but we are taken for granted now. Then parents, students, parents, management and the legal system. These are all the stakeholders. It should be open to external public scrutiny. It should balance the priorities with those of regulating authorities like MCI. Identify both strengths and weaknesses. This I have talked to you about in systems approach. We need to continuously review our strengths and weaknesses, and it should encourage innovation, reorientation according to the changing health needs. It should encourage variety of methods of teaching and learning. It should ensure choice of credible student assessment methods, ensure adequate resources to delivery of curriculum, and it should concern with good outcomes. In quality assurance, what do you think is most important? I have written here, yes sir, but you need to tell me whether external is that NAC. NAC is for accreditation. Validation is usually internal. We usually do it an internal validation, and there can be audits, continuous audits. It should confirm that the medical school's responsibilities are being properly discharged. So that is about quality assurance. Teaching learning methods, we have talked about so many teaching learning methods over 1 or 2 days. We need to use it. I know what happens. You will be telling whether we have the time to do it. We have to find a method We have to find a method, at least one important point that you take out from here, go and implement it in your department. Many people are asking me, in pathology department, do you do all this? We have started it. We have started OSPI. We have started logbook. We have started many things, we have started. And we are trying our best to improve over time. It won't happen in 1 or 2 years. It will take more than that. And then we should have proper digitization. Can anybody give me an idea how can we improve digitization in our college here? Give me some idea where you want digitization to happen.
Application of leave, Wi-Fi.
Application of leave. Okay, so that we don't have to run around. Anybody else? Digitization? No other? Only that one?
Wi-Fi.
Allah, Wi-Fi, yes, that is a tool. Patient records. Patient records would be a very good idea to digitize. Okay. Attendance. We started attendance actually. There was digitization of attendance. I don't know why it stopped.
Restarting.
We are restarting.
Patient records, what has happened over a period of time is that doctor-patient relationship has changed. So when you take this one, you start typing. It has happened when with my experience I'm telling you. Patients will come back and tell you, I'll do doctor, complete computer number nodi maatadudilla, computer maatadutare. So that is a drawback which you have with that. I agree with that.
It should be done, but it should be.
PG interns can be used, ma'am. PGs and interns can be used for translating at that
You are
time.
not creating only medical college staff and PG interns and teachers. You are also creating from IMG is indicated for a clinician who he might be going and practicing also, no? Like whatever they develop will continue. No, that is my view of that.
Okay.
But there is many people have come back and told me
This is the problem.
so they don't want to go back to their doctor
Oh God.
because they don't want to.
No, actually that can be done by some techniques.
See, the thing is, we need to have proper feedback. All this you have told us here, patients are telling you, and this feedback there has to be a mechanism to improve upon it. For example, in the other side, on the corporate hospital side, the complaints go left, right, and center, and they have improved upon the discharge summary cards. I remember 2 years ago, the discharge summary card was so bad. But now I think so it has improved. Many things have improved. What is really required at the end of when the patient is going out of the hospital, what are the drugs that the patient was put on? Okay, that is what we want. So that we need feedback for all this.
And we need the tools to implement. See, instead of typing on the computer, you can be given a writing pad. So whatever you write goes into the computer. So that complaint of interacting with the patient is there. You are still talking and you are writing. But that written matter can be taken by the tool into the computer straight away.
Or voice conversion something.
Voice again you have to talk to the computer.
So that might be something.
No, we are using voice in our department.
But digitization, even government of India is trying to digitize.
Absolutely, I think we'll have to implement it. I was just about to say that.
Yeah,
Many colleges have already started the digitalized process, and we'll be starting it soon.
3 days back I saw.
The only solution is the consultant will be talking to the patient. The PG or the intern at the same time will be digitalizing the entire conversation.
Okay.
And there is modules in the system itself, in our G Health itself, which is already got for chief complaints and whatever is there, it's already having a template. The PG will have to just click on it. What are the complaints? It's just a click of a button. As the consultant is talking to the patient, the PG or the intern will be just clicking on it. The software will already give you the format. It's already there, template. Unless it is something different which needs to be typed.
No, sorry for that. Again, the templates I have some complaints because most of the radiology reports, most of them have a template. On top of that, they will write. Many times after hysterectomy, the reports will come uterus, ovary, normal and healthy. Like
That I think the department has to take care of.
The problem of templates, what I am talking about, like if you.
No, what is
everything normal.
what is talking about is drop down menus.
Drop-down menus, where each of those will be already there. In the chief complaints, you'll have a list of chief complaints. The drop-down menu will be there. The PG will have to just click it as they are listening to the patient, either the instruction of the doctor or the patient.
1 year
Place
from
where I
now,
was working
we
in
will
Mumbai,
do that.
there everything was digitalized. There was no case sheet in the website also. Everything you have to enter in the computer. There were tabs for each consultant. So you have to type during the rounds and it will be entered. The phone also we have the software in our phone. So just type it in your phone, it will be saved to the computer.
But I think less
Okay,
patients,
okay.
that can be done. When you're seeing more patients, that will go on till forever. Yeah.
No, we need to have systems in place, agreed, but it will take a little time. This is a part of quality assurance. Then we need to have quality assurance for monitoring, evaluating and changing the curriculum. Very importantly, we are talking about CBME. We need to change the curriculum according to the times. Benefits of quality assurance by accreditation, it benefits flow from feedback and provided by external reviewers and report. Final responsibility for granting or withholding authorization for award of medical degree lies with the national government. I don't know how good that is. You want to give it, we are doing everything and then we give it to the national government to accept whether he is going to become a doctor or not. At the moment, they are only giving a registration certificate. Everything is going up from us. But in the end, what is this examination that is coming up? Next. So once that next comes up, we'll have to really see how much, what will happen. But that is a part. Next is again a part of quality assurance system. Limitations of quality assurance. Universities, long traditions of academic autonomy to ensure that fundamental education principles are not compromised by other interest groups. What can be the other interest groups? Other than universities? Universities means Rajiv Gandhi University. But then there can be deemed universities. So many deemed universities are popping up. So whether they are going to take over the student influence, God knows. Quality assurance also ensures ethics. We will not go into ethics. There will also, it will come up later. And lastly, quality assurance, you need to have academic leadership. So responsibility of the academic leadership must be clearly stated. It should be evaluated at defined intervals with respect to achievement of missions and objectives. There should be continuous renewal and must, as a dynamic institution, initiate procedures for regular reviewing and updating the structure and functions, and must rectify documented deficiencies. So this is about quality assurance. I just had to introduce this term quality. We have in medical education also something called as quality assurance. But as I told, please don't come last. In the end, it comes down to that word what I told, salary. No, we will not talk about that here. Thank you. Thank you very much. We will break for tea.
10 minutes.
10 minutes, please.
the faculties, how much effort?
Yes,
5,000.
yes, absolutely.
For an extra 5 days of leave. Yeah, that also something. At least something. There will be.
Student people on
Anand, it's away.
Yeah, Balaka.
We'll start the topic now. Two more topics are left. Okay, we'll try to complete it as soon as possible. So the main objective of this lecture is to define what is lesson plan, list elements of lesson plan, plan a lesson, and list advantages of development of lesson plan. So Srinivas sir, how do you take a class? How do you plan a lesson for 1 hour class? How do you take a class, MBBS class?
First, what is the objective of the topic? First of all, I don't take it for 1 hour.
Good point. Good point.
I thought I'm the only one who comes out early.
First, I usually discuss the objective of what is about whatever the topic is. Then, give a brief introduction of that topic, highlight the important points of that topic, discuss in brief and highlight the important points, mainly from the exam point of view, and discuss the adverse effects and whatever we have, adverse effects, contraindications and complications.
What about attendance? When do you take it?
I take at the end of the class.
Starting or the end?
And then, and I call out the names.
Yes.
You have a register.
We take a register.
Yeah,
We have never seen the register.
If you ask your clerk, she will give a list, not a register, she will give a list, so you can take and.
Because we've only had a number calling until now.
We have a register with all the names.
Yeah, we absentees, and then we have to count because they are so clever. I mean, they are so dumb actually. There will be 30 people, but everybody is present according to them in 150, and then I'm like, where are the absentees? Is this the presentees or the absentees? Then we have to count the number of people. I've never seen the register.
Ma'am, about your class, how do you go about it?
I'm only worried about the attendance.
Okay.
I differ only in the sense that mine is not very much exam oriented. I basically believe medical graduates have to read more. So it's a motive. Okay, we tell what is needed for them syllabus, but we need to motivate them because in lecture class, in nearing exams they have to read. Okay, you can concentrate on what is needed for exam, but you on the other hand you have to motivate them to build an interest to read the subject. So that's what usually I do.
So how do you go about it? Then, like, how do you start a class? Then how do you proceed in the class? How do you go about it? Initially, what do you do? Like, you directly start with the PPT or something like that? What?
It always depends on the mood. If the children piss So then you'll be like, you'll agree more. Otherwise, it kind of goes smoothly. It all depends on when you walk into the class, how it goes.
So, remember, I put it in a different way. We are all mothers in school children, right? So, what if the same way our school teacher deal with our children? The day their children piss them off and they refuse or they show it.
It still happens, sir, in school.
I'm asking you, what would happen if the school teachers are like this? And you know, as parents, we don't want our children to come back and tell that teacher got angry on me for no fault of mine.
Yeah, because somebody else created a scene. Yes, that's true. But yeah, but it all depends. But most of the attitude is usually, if they are good, I mean, it goes smooth.
Then how do you prepare for your class and how do you go about it?
Just the same way, probably at the beginning of the class, biochemistry is very, very boring and dry as such. So I usually start off with something interesting related to the topic. Like, just tell them something like...
Why they are doing that? Website.
Oh, what's special about Rbcw? Or something related to the person who discovered Rbcw. So set an induction first and then go on to the topic.
Yeah, so we all have our own way to go about the class what is allotted to us. Okay? So to start with an example, okay? What does this suggest? Where is this or what place is this? Europe, basically Europe, a Europe trip. Okay, a Europe trip. So if you want to plan a Europe trip, what do you do? How do you go about? You go to Make My Trip, or you go to Rbcw, or Thomas and Make Money. Yeah. So they give us an itinerary. Okay. So what are the aspects you see in those things? What do you want in those things?
Good accommodation.
What are the
places they are going to cover?
Yeah. You will suggest or they are going to give you. Okay. Then
Good accommodation.
good accommodation, number of days, cost, value for money, vegetarian food. Then each day, what time you spend, leisure, then activity, then or shopping or sightseeing. Okay, what time you wake up, what time you want to sleep, all those things. You know how it goes. Day 1, day 2, day 1 you have 1. From 9 to 10 you will have breakfast. 10 to 11 you will have this. 11 to 12 you will have next activity. So it goes on like that. Even the travel, how do you want to go from here to Bangalore, from Bangalore to one place. So everything is chalked out there. Everything is planned properly. Only then you decide, you travel, then you come back and you give us feedback. You tell them what if you have gone wrong, if they have gone wrong in any aspect. They have not shown you one place which they have told you they will show, but they have not taken you there. Or it was overcrowded, or your bus, whatever they told they will take you in a car or something like that, it was overcrowded. There were other participants also, other tourists also. Okay, you had selected a limited number, your family, probably 5, 6. So limited number were there. So you wanted only 6 of you to travel. You didn't want other people to come along with you in the cab, all those things. You would have mentioned and they will plan exactly according to that. So in our curriculum also, it is very important to plan how to go about a lesson. CBME, especially in the CBME curriculum, it is very important how to go about what is the time duration that is taken. Okay, time duration that is taken. So just to brief on what exactly is lesson plan, then we'll directly start with the activity. So a lesson plan is the title given to statement of the achievements to be realized and the specific means by which these are to be attained in the smallest unit of educational experience provided to learners. So a lesson plan is instructor's roadmap. It is our roadmap for what students need to learn, okay, and how it will be done effectively. Okay, you can teach anything, whatever you want you can teach, but is it effective enough? Have they gathered anything? Have they gathered any information from that? That is very important. And as Sir said, 60 minutes, you do not engage entire 60 minutes. It is, even now, if you want me to take for 60 minutes, will you be interested? No. First 10 minutes probably you'll be enthusiastic. Then same old story, you will not be interested. So 40 minutes, 40 to 45 minutes. Okay. So what are the characteristics of lesson plan? Flexible. It should not be just like a textbook again, because textbook anyways they will read. So you should make it more interesting. It should be relevant, clear, feasible, dynamic, and it should not be too detailed also. And that should be a continuous revision in your lesson plan. And again, if department agrees, if you have created a lesson plan, if you are not there on for emergency leave or something like that, so other can follow that. They can see the lesson plan and they can take the class. So what are the resources we use? We use AV8s, the audiovisuals, the chalk boards, overhead projectors, handouts, LCDs, models. Then advantage. So it helps the teacher in planning the teaching, learning experience, the methods in a systematic way. Okay, it helps the teacher to perform better than the other mode of learning, which is without the lesson plan. It helps teacher in remembering the contents, what they have to talk, and what is the duration they have to talk. Okay, then it will remind the teacher what equipments they have to use, what materials they have to use. Okay, sometimes you might take your chart or your models from the department. You want to take. You go to the class and after half an hour you'll see, oh, I had this model in my department. I'll get it next class. We'll see it next class. That shouldn't happen, because that next class will never come. So you should know what materials you require, what equipments you require. Then the presentation should be systematic, and time management is very, very important, and it helps you. If you have a lesson plan, it helps you. Then it improves the practice of teaching. Okay. So in a lesson plan, we have to cover these elements. Okay. So you have to know what is the topic. Next, the target audience. Which class? Okay. What is the target audience? The duration of lesson plan, the specific objectives, and set induction. Okay, set induction. What is set induction? As Janice just now mentioned regarding biochemistry, it is very boring. So you need certain aspect to make it interesting. Or I think Kishan sir was explaining that time. He usually puts a picture at the beginning of the class. Then he goes on to teach. So that picture, that will induce, that will start the conversation or the lesson. So that is called set induction. There are various modes. You can use videos, you can use various other aspects, a small play or something, okay, a discussion or something. Okay, so there are other modes of it. Okay, that's set induction. Then the contents of a lesson plan. Okay, then the teaching learning method, what you use there. Okay, then of course you have to have an evaluation of whatever chapter or the lesson you have engaged or you have taken in that particular time. Then a follow-up action. Follow-up action is any assignments, okay, or in-class MCQs, all those things, whatever, whether they have understood the class or not, those things are the certain follow-up activities. Okay, this is a small, a simple model of a lesson plan. I have circulated it. Okay, it is there in your table. Okay, I have given you two sheets. One is lesson plan, which we will be doing now, and one more is the skill lab, or AJ skill lab has been doing this session plan already. Okay, they have this format that is just for your to see how they are going about the session plan. So today we'll try to have a brief or try to formulate a lesson plan for the SLOs that are given or that have been given to you yesterday. Okay, competency SLOs. Okay. Now I'll give you two examples here. Just see the presentation. There are two examples. Okay, because lesson plan depends upon the domain. Okay, what is the domain or what class you are engaging? Okay, so now if you have a knowledge domain, okay, if you have a knowledge domain that is cognitive, okay, where they have to just remember, they have to use their brains. It is basically theory class. Okay, you go to a lecturer, you do, and better to have only 40 to 50 minutes class. Okay, it is better to have 40 to 50 minutes class. Okay, so for this I'll give our department example, that is forensic medicine. So this is our competency where we describe putrefaction, mummification and adiposity. So here domain is the knowledge, okay, where they have to give the cognitive domain. So target audience is second year MBBS. So at the end of the class, this is our SLOs, okay. They have to describe the various changes seen in the body due to putrefaction, define adiposity, then describe adiposity and its medico-legal importance, then define mummification, describe mummification and its medico-legal importance. These are the SLOs for this particular competency. So what are the resource material I require? One is the PowerPoint, AV8s, okay, desktop, laptop, if it is there. You have to again confirm in the lecture hall whether it is working, because we have seen, you know, we have experienced, some of us have experienced, the PowerPoints are not working. We come to the department, take our laptop there. So you have to prepare in advance, because you will be wasting time otherwise. Okay, then chalkboard or whatever is required. Then in the teaching learning methods, that is with the duration. Okay, so we start with an example. So that is introduction, set induction. Okay, start with a case example. Okay, we have seen a body, okay, which had maggots, which had swollen up. Okay, so all those blisters were there and the skin were peeling. So we start like that. Okay, introduction. Then we explain each SLOs. So SLOs 1, that is regarding putrefaction, we have given 20 minutes. Then 2 and 3, that is adiposity, both 10 minutes. Then 4 and 5, mummification, 10 minutes. And 5 minutes for the summary. Okay, that is done. Then the assessment, formative assessment, we give MCQs, either Google Forms or Kahoot or in-class MCQs, whatever it is. Then the evaluation. Okay, this is about knowledge domain. Now comes the difficult part, that is the skill domain. Okay, the psychomotor or the cognitive domain. Okay, the affective domain. Okay, so here skill is required. Okay, the attitudes, the communication, all those required. So you might require the help of a skill lab or a practical lab or a demonstration room separately. Okay, so you divide accordingly. Okay, so here what example I have given this regarding an episiotomy. Okay, OBG. So observe and assist in the performance of an episiotomy and demonstrate the correct suturing technique of episiotomy in the simulated environment. So when it is given simulated, they have to use the skill lab. Okay, it is better to use a skill lab. So these are the target audience, then learning objectives, then how to demonstrate episiotomy and its repair. Okay, then resource material, skill lab, then task trainer. Then you have to also mention 3 facilitators. Facilitators in the sense you require 3 people, that is 3 staff for that particular class, 3 faculties. And remember, in the target audience, you have to mention the number of students. okay, in the number of students. You cannot get all third year MBBS students to the skill lab and teach them. Okay, so you have to divide accordingly. 15 audience, so 3 facilitators, 5 each. Okay, you have to divide that. Then the teaching learning method, the instruction, that is for first 10 minutes, and then the demonstration, observe, assist, perform. Okay, teaching learning method for 60 minutes, then debriefing for 10 minutes. Then you do an OSCE for 30 minutes. So usually these are usually 2 hours class. The practical classes, the SGBs, all those things are 2 hours class. Okay, so within around that is 100 minutes. Okay, around 1.5 hours or 1 hour 50 minutes, you try to complete the class. Okay, where last 30 minutes will be the assessment, OSCE assessment. Okay, then you have feedback, students' feedback and teachers' feedback. Okay, so that is about lesson plan. So now whatever SLOs and whatever competencies are given to you, you have derived certain SLOs. So based on that, prepare a lesson plan. Okay.
It's coming. It's already coming.
Next batch.
20 batch. PGs. just as you are doing your lesson plan, I'll just share one experiment that Dr. Professor Ramnarayan always used to do during the medical education session. It is widely available on YouTube, but just a small way in which the old school used to understand lesson plan. And it's just a summary of this entire thing. Now, there are three, if I could just have your attention. As you are doing your lesson plan, I just will talk about a small summary of this lesson plan. Now, just to have this players here, this is the syllabus. This is the entire syllabus that you now got to teach your student. Is there any which way this syllabus will enter the student entirely? There is no way this can enter. So always remember, like Veena ma'am was telling in the morning, there is so much of information in medical, you cannot teach everything to a medical student. So you need not give the entire information. There are 3 I's that are always important. One is about the information. Information in this entire syllabus. It's all available in the tip of your fingers today. You go to YouTube, you can have Marrow, you have hundreds of places where you can get information. So don't always plan your class in such a way that you're planning to give information. The 2 other I's that you're rather wanting to talk about is influencing them and inspiring them. These are the 2 I's. The information will automatically come any which way. So influence is rather telling them about what that topic is, how that will be impacting in their practice tomorrow, and giving them that kind of feel. And inspiring them is telling what's important in that class, what part of that can come as a question, and all these parts. So this information now needs to get into the student. Here's a beaker. This is we as a teacher. So we need to now separate this information, prepare for your class, and fill up this beaker. Now, this needs to enter the student. We are ready for the class. We come fully prepared. We know now we need to teach the students. Students are sitting there. You come and pour it. What's gone into the student? Why? Absolutely. What does that indicate?
Prepare them to be
This
ready to take the
uncapping is what we talk about, the set induction. Set induction is this uncapping. No student will be ready for the class. They'll be with their own world. Get into the set induction first. Give them the influence of that topic, why you need to take that topic, and what's the importance of the topic. And then start your class. Now again, repeating what we did. Now okay, you have done a good set induction. Students are ready. Come and pour it. Better. Something is gone, but not everything is gone. Why? Because you have prepared very well. You have come and just dumped it on them. Is that helpful? No. The point what we need to do is slowly feed them. Very slowly, drop by drop, feed it like a child. Whom you will tell a story, tell some stories about stars in the sky, and feeding the child. This is what you got to do. Stories and then feeding it. This is when it will get better. Any which way that can get even better, even easier. Biochemistry, so a lot of biochemistry equipments. This is your AV, audio visual aids. So make use of these audio visual aids, do it better. Now, this can only sometimes harm. We had a session by Padmini earlier this morning where we said how to use PPTs, writing on the full board, telling that this is what you got to know, will not know the funnel properly, use it effectively, and only then start pouring it. Becomes much easier. Fine? So at the end of the class, you just walk away. Whatever little is gone in will be volatile, will be away from this by the time you come back. What do you need to do? Recap the session. Evaluate the session. Once you recap it, you have done a complete lesson plan for your class. Fine? So this is what Dr. Professor Ramnarayan does in every session. So I thought I just read it.
Any group is ready with the lesson plan?
Definition and classification.
In the end of the course, we are going to assess you. You will be said, we will be judging you whether you are pass or fail. At the end of these 3 days, so there will be an exam.
Certificates will be given only to those who pass.
Certificates will be given for those who pass the exam. It is?
Combination of both.
I have no idea what is formative, what is summative. Let us see some of the slides here. Okay, so sir wants to know which domain it comes again. So
First, tell them that you can do it later then.
Yes, please. Today, with the lesson plan, what we are doing is, you will be continuing and discussing in groups later on also. Tomorrow, we are discussing this tomorrow, along with the ad hoc. Alright? So all of you got it? Can I have the attention now? Yes. Do you need the exam tomorrow? No. Then why do you have it for students? Do we need exams in medical curriculum? Do we need exams? One second, we'll go one by one. Here. We need exams here.
Yes.
Yes, yes. Now, why? Yes, ma'am.
When we reach the casualty in
Okay.
the hospital, there should be somebody who is
Okay, so
competent. You should know that that condition exists.
the condition exists. Okay. So any differ in opinions, in references?
Not just
Everybody says yes. We need exams.
Any,
I mean, like
any patient, not just me. I'm saying any patient.
These exams
blindly we cannot give the certificates.
If there was opportunity to assess them day-to-day basis, then probably exam was not required.
Very good.
Probably
Yeah.
That is not possible in a crowd like MBBS crowd. If an assessment was possible day-to-day, probably exam was
Another question I want to put. Summative assessment, is it required? Summative assessment, is it required?
When they're having it till 12th standard, they might also have it.
Now, in our curriculum.
Criteria for a degree.
Pardon?
Criteria for a degree.
No, it's not.
Criteria for degree. See, summative, even we have at different phases. Degree is given at the end. Different
First
phases.
year degree. First year, I mean, what's it? Yearly.
It's like a quality assurance. Quality.
But that we are not assessing,
Yes.
no.
No, pass or
If
fail.
somebody is absolutely great, we don't give them the, the only doctor in this batch kind of thing. We don't do that. We give everybody everybody who passes gets a degree.
Formative
We're not
assessment,
making sure that he's the best.
formative assessment to know that whether student or teacher moving in a correct direction. We can correct our way.
Correct. Now the question is of summative assessment.
Summative is at the end, at the end.
Correct. Do we need it?
Yes,
Yeah, another. Yes.
Whether they have understood the subject concept they move on to the next year, whether they can some more subjects.
So formative is doing, I suppose.
Formative
All
is
throughout the
short
year.
term, short term. They may remember that. Formative is long term basically.
See, summative, the common problem, exam. I have abdominal pain. Correct? Pain abdomen. And grandmother. So every phase, grandmother, summative. Just because. So can I be the victim of it?
Who?
Just because of my pain abdomen or as a student.
No, who are we talking about?
Student. Yeah. You can conduct an exam again later. Feasible?
Then we'll be conducting exam every other
Feasible?
day. Then we'll be conducting exam every other day.
Now, is it the conclusion that summative assessment should be taken out of this syllabus?
No.
I mean, no again. Okay. So,
It adds up, no? For the end. End when they get some bonus.
tell me the advantage then. How little bonus is
If
it?
that day of their exam they was under pressure, they didn't write or maybe they didn't read that particular question and then they didn't do well. Somebody was time short or something like that happens on that last final day. That some 20 marks from here give them a boost.
No, let me just. We have some food for thought. Anyway, can this formative assessment, the results of this, can it be taken to the summative assessment and added and put together? Pass or fail?
Yes.
Can
Yeah.
We can try to exam happens like this.
Pardon?
Can be done.
Can be done. So what is better, you think, and we will just discuss later on also. So now just some information on these. It's already given to you. What is formative assessment? And now again, so why do we these assessments? So why do we need the assessment? Just all of you together, because we need to, okay. So it helps both. It helps teachers to decide whether the student has learned. For students it is to acquire, just to help the students to acquire and improve their competencies. What should be assessed now? So are we assessing what we are desired to assess? I mean, like what we are supposed to do it? Now comes again and again the same questions, clinical reasoning, critical thinking, affective domains, correct? So we are giving an essay question, maybe in clinics also. So bedside it is going on. So how subjectivity is there, objectivity is there, how much it is. So it depends on all those parameters. So assessment requires specification of measurable and observable entities. So gradually we are taking off those subjectivity. So get this objectivity into these. Operates within the framework of competencies. Now, whenever we talk about assessment, aligning with the, you have learned today. What did you align today? Did you align anything? Don't look so serious. Any activities done, SLOs. Did you align teaching learning method with SLOs? You aligned it, correct? Now, did you align assessment with teaching learning methods and the objectives? No. Tomorrow you will be doing it. Alright? Until now, we have derived objectives, we have aligned teaching learning methods. Assessment aligning will be done tomorrow. Alright? So, it depends on competencies, SLOs, teaching learning methods, all these assessments. Now, this is what we have seen yesterday. So, ongoing process during the instruction, we are doing the assessment, that is formative assessment. Now, some of the characteristic, yes, Kishan, can you just go through fast those? Please.
Formative assessment is mainly long-term, longitudinal nature, which is ongoing throughout the year.
Yes.
Direct observation of students can be possible, which improves the utility of formative
direct observation of the students. So your usefulness, yes, feedback is another factor in formative assessment, where with the feedback it helps to improve.
We are giving the feedback to the students, or students are giving us the feedback?
We are, ideally it is both the ways.
Both.
That is why helps teachers, helps students. So that was the first thing what we discussed. Next one, please.
Since the stakeholders are less, only the students and teachers, so purpose is to improve learning, high standardization is not required.
So it is not deciding the fate of a student, formative assessment, that he is fail or pass, or whether he is losing 1 year or something. It's a low stake, comparatively. We can have flexibility here, it will improve learning there. Next one.
Multiple assessors, multiple tools and multiple assessments improve validity and reliability.
Very, very important. Srinivas always says, only Mohandas Rai sir is going for the summative assessment. So include everybody. It is not only for that purpose, it is like they are also teaching in our department. They are also the stakeholders of this teaching learning part, and they will have that hands-on experience. So with experience they will learn. That is possible with this formative assessment. Very, very important. Summative may not have so much. Next one. What is now internal assessment? What is it? So it can be both formative and summative. It can have the aspect of it. Correct? So now, how is it going in your departments like? So internal assessment. So how many internal assessments we have per year? 3. For first year. So what is the advantage here? It is done by
the one who taught.
The person who is teaching, he can assess. He knows the learning methods, so he can have a good idea over what he is expecting from the students and how they have learned. He knows it.
And advantage is what Madam told. It's not on the exam day, if because of some pressure and all, you may not be able to perform well. But we have seen this for the entire month how he is doing. So
that is what
based on that also we can give marks. Not just on exam day performance, but the entire month he has attended, he has answered well. Means on the exam day it is not performed.
Thank you. So that's why we mentioned their day-to-day variability. So he is doing fine, but exam day maybe in summative assessment he is not well or something like that. So that loses the, that is one disadvantage what we have. So here day-to-day variability can be assessed here. Then next one, larger sampling. What is that?
When syllabus is more, partly
yes.
we can study part by part.
Yeah. But sometimes what happens in exams, summative exams, so central nervous system, no questions from there. So we had early clinical exposure, we had electives, no questions from there. Correct? So there are subject is vast, definitely. So ideally we need to have all the sections, all the aspects, all the domains, but it will be missing here larger pool. We can have many formative assessment based on your own. How many you want, we can just have the exams. So next, so what? Definitely it carries both formative and assessment. We can use it as content and the process. So another advantage. So we know the content and the process of learning there, what and how the students have learned throughout the course. This assessment gives priority for all the domains. Again, theory, 100 marks theory is there for the summative we have. Though we have the practical and this one, all the domains we might not check, but when it comes to formative, we can have the flexibility of our own. Now, so while you are designing an internal assessment, most important thing is to take care of these aspects. So learning domain, learning levels we need to know. So how much he needs to know. So knows how, all the sections we need to cover. So that is the importance that you will be doing it when you are designing internal assessment. Now what is the scheduling? When do you want that internal assessment to be there? So we have a set of internal assessments. How many we have? Around 3. So anything they have specified for the third internal assessment?
Before final exam.
Before final exam, almost it's a preparatory exam. Okay, entire portion will be there.
Practicals will be there. Not only theory, practical will be added.
Okay, so that's for the theory. So what about the practicals again? It depends, first year, second year, third year. So can you know who is from the first year here? Can you please raise your hands? Okay. So one question, is foundation course or early clinical exposure or ADCOM, anything is added either in formative or summative in your first phase?
As per the rules, 5 marks have to be allotted for ADCOM.
Okay.
In
So
the formative assessment.
ideally, we are supposed to add, yeah, foundation course can be, we can take it up with formative assessment, so may not be there in summative, but when it comes to other internal assessments, we can assess it. We need to have one short answer for the short note for the ADCOM. So we can include all this. So coming to the third year and fourth year, we have something called as electives. So even in final year. Now, how many of final year, can you please raise? Okay. So in final years, we have allied subjects also for medicine. Anybody from medicine? So what is the share for psychiatry? What is the share for dermatology? Internals.
Yeah, we have 1 or 2 questions in 10 marks. 1 or 2 questions.
In final year?
It's final exam.
Radiology.
Included, radiology is not included in medicine.
It's not included in medicine.
Psychiatry is involved. So
Okay.
we can ask 1 or 2 questions.
Yes. What about surgery now?
Surgery we have orthopedic and anesthesia.
Orthopedics and
Anesthesia.
anesthesia. Nobody wants radiology now. Okay. As per the module what they have given to us, so anesthesiology goes with surgery and dermatology, radiology.
Dermat also, psychiatry.
Okay. So that confusion is there. Okay. Now, components of internal assessment goes with theory and ADCOM, practicals, clinicals, all these. Alright, so you have many ways of, you have just seen in previous class how many types of written exams are there, MCQs, essays, short essays, all those. And for clinical exam, again tomorrow we have a session on that, skill and clinical examination, workplace based assessment. Then feedback in internal assessment, we have been talking about this. So Are we doing it is again question. Feedback. Are we dividing students after internal assessment? Ideally 2 weeks is the time what they give. How many have, no, that is not assess or evaluate. Yeah, so next one, last one was record keeping. Is it needed, record keeping?
Yes.
Why?
In case they go to court.
In case they go to the court. Okay, so inspections can be there. Audit will be, inspections will be there, definitely. NMC inspection, they might come and look at whether you are doing it or not. Alright, how to make a formative feedback? So very fast. Address the topic, address the response, what is their response? Then going with discuss specific gaps, if anything, what they have missed. So actually we were doing it while mentoring, and when they come back to us for giving extra marks, we will be telling them. It's not that we are not doing it, we are doing it, maybe not to the perfect 100% level. Provide examples that work, provide gentle guidance to them, provide an opportunity for review. So this is one part, this is a proposed model. So you can have 15 seconds, you can have a look at it so that you will understand what it is. This is just a proposed one, model what we had. For internal assessment, each assessor to contribute not more than 25%. That means we need to have a multiple assessor, correct? Yes or no? Yes. Each assessment tool to contribute not more than 25%. It is not just the theoretical exams what we need to have. We need to have all types of assessment tools. Each assessment will contribute not more than 25%. This is slightly delicate because preparatory exam is of 100 marks and so for a course, so may be followed, may not be followed, but ideally, what is proposed is this: each assessment will contribute not more than 25%. So challenges in implementation. Should I ask you? Let us just go ahead. Okay. So large number of students. So if we have more number of assessors, definitely we can. So feasibility is good there. So time factor. Now we have 20 steps. Our pharmacology, we have 20 steps for IV administration of the drug. So when it comes to exams, so in okay, internals it is fine. We are giving them the arm, and from washing hands and wearing gloves until taking out gloves and disposing it. So around 20 steps are there. Each step, if they do in final exam, when all externals, everybody is there, so it is time consuming. So time factor is also there. Availability of adequate faculty. But again, vastness of the curriculum, as Sanjay said. So lack of adequate motivation. Why? What is that lack of adequate motivation? For whom? I'll leave it to you. Now strategies, one person has used MCQs, match the following in the class. He has given it, and what he did is, he has given the answers there in the class, and he exchanged the papers and did the assessment. Is it not a good strategy? He used all the assessments, he made them corrected, and so next one again, after the class of bleeding disorders, telling them to create, prepare 5 MCQs. So they should have a class of Arvind sir also, so before they prepare 5 MCQs. So just the workplace based assessment, just to have a look at it, only of workplace based. So that's it. Any questions, please? This again we will deal in tomorrow's sessions. All these different types of assessment methods in skills.
Volunteers for recap for today's morning and afternoon.
Yeah, so doing the recap tomorrow? Yeah, volunteers please for the recap. I'm looking at people. No eye contact. So very important when we are taking a lecture. And I want to ask, see, interim assessment. So is this slide good or bad? Why bad? Okay, so I did the interim assessment of thank you.
You were not there for our class.
Somebody please volunteer.
Give us all these presentations.
Yes, sir, we'll give it.
You can put the camera.
Yes. We can keep opening, looking at the things.
Yeah, yeah.
Is there any all these things are there in the AJIMS set?
Yes. Information is there, sir. One or the other. Who is the President of India? Who is the Vice President of India? Vice President of India. Okay, so Praveen John sir will be doing recap tomorrow.
Our team presented today morning. Because our team, he presented, we gave him input. I thought other two teams also should come.
Yeah, that is about morning session, afternoon session.
Because our two teams presented today.
Nobody will take.
Nobody's taking it, it's not a big deal.
Okay, in this group, please, we need the. Yeah, so someone please, all of you, how many are there? Please pick these. All of you, please take it. Take one, please. Take one, please.
They're so scared of
Please take chocolates.
Okay, you have the participant list. The one where they have all signed participants.
Numbers.
Number.
So number 29.
29.
Who signed against number 29? And number 15. 1, 5,
Okay,
and 2.
so 15 and 29 will just tell you.
The person sitting on the right side.
In this case, that is
I'm taking the morning session. He's ready for the morning session.
29 Chandrasekhar sir.
I'm 15.
You are 15.
See, I picked up 2 birthdays for my family. So,
I take the morning session.
oh my God.
I know, I take the morning session. That is easy.
Perfect. Three people in the same group are not nothing like this.
All right. So, all right, shall we disperse? Yes, thank you.
Sharat, tell them to take the papers. The papers will be confusing.
Please take all the papers. Yeah. Please take your papers.
Please get all the papers tomorrow, including the lesson plan.
Whatever on this table.
Priyanka, what are the